Lately, ivermectin's been making waves on X. This drug originally for parasites. Could it actually take on cancer? People are sharing amazing success stories, some even claiming it outshines chemo. Hollywood star Mel Gibson said on the Joe Rogan Experience that 3 of his friends with stage 4 cancer used ivermectin and fenbendazole, and now they're cancer-free, shouting, "This stuff really works." Canadian cancer expert Dr. William Makis has shared cases too, saying it saved his patients. US surgeons are reporting similar experiences. Is this for real? Today we're digging into the buzz, from online tales to scientific research, to see if ivermectin's got a shot at beating cancer. Let's kick off with these stunning cases. On X, someone posted about a 52-year-old pancreatic cancer patient with a 4.3-centimeter tumor. Chemo failed, so they switched to high-dose ivermectin, 1 to 2 milligrams per kilogram daily, and their tumor marker crashed from 438 to 61, an 86% drop. Dr. Marquis shared a 60-something stage 4 colorectal cancer patient with liver mets. After high-dose ivermectin and fenbendazole, their CEA marker dropped, chemo side effects vanished, and they said they felt much better. A 40-year-old UK woman with late-stage lung cancer started 1 milligrams per kilogram ivermectin and 444 milligrams fenbendazole daily last August. 3 months later, her tumor shrank and she could breathe normally. Another stage 4 melanoma patient used ivermectin, fenbendazole, and mebendazole together. 43 days later, the tumor started shrinking. Marquis also mentioned a 53-year-old Canadian with a 15-centimeter bile duct tumor. Chemo didn't work, but ivermectin, fenbendazole, and CBD THC oil led to no cancer after 14 months. A 70-something US tongue cancer patient refused surgery, took 1 milligram kilogram ivermectin and 888 milligrams fenbendazole daily, and their tumor shrank, surprising their doctor. Marquis has more. He talked about a 35-year-old US woman with stage 4 breast cancer that spread to her lungs and bones. Doctors gave her months, but starting October 2024, she used 1 milligram kilogram ivermectin daily plus 400 milligrams mebendazole, and 2 months later her lung lesions shrank significantly. A 62-year-old Canadian man with relapsed late-stage lymphoma switched to ivermectin and fenbendazole in summer 2024. 3 months later, his tumor was noticeably smaller. US surgeon Kathleen Ruddy shared a stage 4 prostate cancer patient who, after doctors gave up, started ivermectin and saw his metastases disappear in 6 months. Dr. Charles Bend from the Bend Institute said an ovarian cancer patient's tumor shrank with ivermectin, exceeding expectations. On X, a 45-year-old US woman with stage 4 cervical cancer, given 6 months in 2024, used ivermectin and fenbendazole. 3 months later, her tumor halved. A 66-year-old Japanese man with metastatic stomach cancer started ivermectin in fall 2024. 2 months in, his stomach lesions reduced. Mel Gibson's friends beating cancer with this combo just heats things up more. These stories are inspiring, but what's the science say? Ivermectin's an old-school drug from the 1970s, made for parasites. Effective, safe, even nabbed a Nobel Prize. But lately, scientists think it might have more tricks. In the lab, it stops breast, colorectal, and leukemia cancer cells in their tracks, triggers cell death, or cuts off tumor blood supply. A 2017 Mexican study found it targets breast cancer stem cells, aligning with X-Buzz and Gibson's claims. In mice, it shrinks breast and colorectal tumors and boosts chemo's punch. Paired with immune drugs, it makes tumors easier targets for the immune system. The catch? Lab tests need high doses, way above human safety limits, and mouse doses don't fully scale to people. Is that a hurdle? For humans, the evidence is still thin. As of February 2025, no large clinical trials prove ivermectin fights cancer. Cases from X, Gibson's friends, Makis and Ruddy are uplifting, but they're just anecdotes, no control groups, no long-term follow-ups. A small Ecuador study said 19% of cancer patients tried ivermectin, but the data's too sparse to judge. You might wonder, labs need 10 to 30 micromolar concentrations to kill cancer cells, but the human parasite dose of 0.2 milligram kilo only hits 0.02 to 0.08 micromolar in blood. Even the higher 1 to 2 milligram kilum from these cases reaches just 0.1 to 0.4 micromolar. Way off, right? How's it working then? It's not a total contradiction. Scientists guess ivermectin might hit higher levels near tumors, unlike the lab's even spread. Or maybe it's not just killing cancer directly. could be boosting immunity or teaming up with fenbendazole for extra effect. Many cases used combos, which might explain low-dose success. Cancer type and individual differences could play a part too. But these are guesses, no trials confirm it, and high doses carry risks. Plus, these reports highlight wins. Failures might not get mentioned, skewing the picture. Patients improving could be real, but we can't say it's ivermectin alone or something else at work. So, what's ivermectin's shot at cancer? Let's break it down. Lab studies are strong, 80% say it works. Animal tests are solid, 60% show results. But human data's under 5%, still early days. Dosage is tricky. Too high risks trouble, too low might not cut it. Overall, there's a 20 to 30% chance it could work. Potential's there, but it's not certain. Teaming it with chemo or immunotherapy might make it more promising. So, the X-hype, Gibson's tales, and cases from Marcus and Ruddy have some grounding. Ivermectin shines in labs and mice, but it's not a proven cancer fighter yet. More evidence is needed. What about scientific trials? There's progress underway. City of Hope Cancer Center in California is running a trial testing ivermectin with the immune checkpoint inhibitor anti-PD-1 for triple-negative breast cancer. Animal results were encouraging, and it's now in human testing. Another trial registered on clinicaltrials.gov, NCT 05318469, is exploring ivermectin plus balstilimab for metastatic triple-negative breast cancer, an I2 phase study recruiting patients to check safety and efficacy. Small studies, like the Ecuador one, noted 19% of cancer patients using ivermectin with some improvement, but without controls. It's not conclusive. Scientists say these trials are early, data's limited, and nothing proves it works against cancer yet. Still, they note ivermectin's cheap and safe, making it worth more study, especially in combo therapies. In the next few years, with more funding and trials, we might see a breakthrough. Now, William Makis, he's got a stash of cases. From his ex-post, Substack, and interviews, he's shared at least 20 specific examples, covering pancreatic, colorectal, lung, melanoma, bile duct, tongue, breast, lymphoma, and leukemia, 9 cancer types. He says patients using ivermectin and fenbendazole saw tumors shrink, markers drop, some even recovered fully. That's just what he's made public. He claims thousands have reached out, so the total could be higher, though not all are detailed. Since no one's funding large-scale trials, how effective it really is stays unclear. But these stories show hope's alive. From lab advances to patients turning the tide, every step hints at possibility. If we keep pushing research and exploring, ivermectin might become a new tool against cancer, helping more people reclaim their health. Let's look forward to what's ahead. That's it for today. See you next time. Like this, hit like and subscribe.